all of these people, have needs for medical, dental, legal, child support, taxes, all these issues that have been mountains in front of them for all these years, and a cause, a trigger for them to go back and use again. They need to get these things taken care of. So with our social services department and with our community partners, we're able to accomplish that for them while they're here. When a man comes into the program, one of the first things he does is goes into our medical clinic and gets a TB test, now a COVID test, and a once-over by the nurse practitioner. So the Convalescent Care Center, again, was started in 1991, and it was for men that were being discharged from Ben Taub and LBJ hospitals due to an accident, injury, illness, or a surgery. And where does a homeless person go when he comes out of a hospital? Does he go back to the streets? So the mission provides a respite facility for them. We have 28 beds downstairs. One of the big things is to get these people back on their feet, and preferably to get them into some type of housing or get them into a condition that they can go back to work. Our definition of the homeless are those that are mentally ill and addicted. And so if you can help them to get through their mental illness part of it through medications and therapy, that's very helpful. The mental health problem here is that the mental health hospitals don't have the capacity to keep anybody long enough to really make sure that they've number one, had the right diagnosis, and then to prescribe the right medication. They'll prescribe a medication, but it's usually after a number of hours, maybe a day or two, that they keep the person in the hospital. But the next thing, they are discharging that person back out to the street with a 7-day supply of medication and a 30-day prescription. One of the hospitals has 9,000 drop-offs a year. 9,000 drop-offs going into the psychiatric hospital. Another one has 9,000 discharges every year. And so you just know that they don't have the capacity to house them long enough for this to really take effect. We have leased all of our convalescent care beds to the Harris Center for Mental Health and IDD for medication adherence observation for mentally ill patients. What it's doing is it's filling a gap that's been identified that it fits exactly what I just said, and that is those discharges that are discharged after a couple of days in the hospital, getting their medication, getting their prescription, and then only to see this person again, frequent flyers, right back in the emergency room. Why do people stop taking medications? They stop taking them because they make them feel terrible. They make them feel great. Hey, I feel great. I don't need to take my medication anymore, so they stop taking it. Or they can't afford them. And so one of the things about here is that with Harris Health supporting our facility here, all the medications are paid for through that. September the 24th, our gala. Please reach into your pockets, and we need your help. And please think about how your contribution can make a difference in a man's life, and not only in his life, but the life of the people around him, because a lot of these men do have children. It's your resources that help us to make that happen.